Welcome to my channel, Body Talk. Introduction: stent to increase blood flow. A stent, a small metal mesh tube, keeps your artery open. People with coronary heart artery blockages frequently benefit from stents. Aortic aneurysms are treated with stent grafts, which are composed of fabric and metal. Stents are usually permanent. After a stent is placed, you might need to take medication to reduce your risk of a blood clot. What is a stent? A thin, expandable mesh tube called a stent is placed into your artery to maintain its opening so that blood can pass through. During angioplasty treatments, providers frequently move plaque out of the way before inserting stents. For arteries with weak walls, a specific kind of stent known as a stent graft can act as a replacement lining. Stents resemble miniature nets used for fishing. Stents are often made of metal. Stent grafts are composed of cloth and metal. The size of a stent might change. Your coronary heart arteries are lined with stents that range in length from 8 to 48 millimeters. A golf tee is longer than this. Its width ranges from 2 to 5 millimeters. This is around the same width as a crayon tip. Other artery stents may be bigger. Stent types. Stents come in a variety of forms, each intended to address certain arteries or problems. Among the examples are drug-eluting stent. This type of metal mesh stent prevents your artery from narrowing again by coating it with medication. For heart arteries, this is the kind that doctors most frequently employ. Bare metal stent. This is composed of cobalt chromium, stainless steel, or nickel titanium alloy. It has no medication on it. These days, providers seldom ever employ this type. Biodegradable stent. This is a more recent and less common variety. In a few months, it degrades in your artery. Metal stent and polyester fabric. This is sometimes referred to as a graft or stent graft. A metal mesh frame is covered in fabric. This kind is used by providers to strengthen weak areas in big arteries, such as the aorta. Stents that are placed in your arteries are the subject of this article. However, there are different kinds of stents as well. These consist of ureteral stents, which facilitate the passage of urine from the kidneys to the bladder. Airway stents, which maintain the opening of your breathing passages. What is treated by a stent? The most common treatment for serious artery blockages is a stent. Plaque accumulation is the cause of these obstructions. A stent can be compared as crowd control for your artery. The stent keeps the opening open so that blood may flow through after your doctor has cleared the plaque. Stents may be necessary if you have carotid artery disease. Blood flows to your brain through stents in your neck's carotid arteries. This may reduce your chance of having a stroke. Coronary artery disease. Blood can reach your heart through stents in your coronary arteries. This can aid in heart attack prevention or recovery. Peripheral artery disease. Stents improve blood flow in the arteries in your arms, legs, or pelvis. Renal artery disease. Your kidneys' blood flow can be enhanced by stents in your renal arteries. Aortic aneurysms are also frequently treated using stents. This is a bulge in the aorta, which is the major artery in your body. The bulge develops where the walls of your arteries are weak. Your aorta stent graft acts as a replacement lining for that section. This reduces the chance of an aneurysm rupture and enhances blood flow. How do stents become positioned? The condition the stent is treating determines the specifics. Typical stent implantation techniques consist of percutaneous coronary intervention, PCI. One may refer to percutaneous coronary intervention, PCI, as coronary angioplasty, or the implantation of heart stents. Stents are inserted into your coronary arteries by your physician, typically using a catheter in your groin or wrist. When most people hear the word stents, they think of this: carotid artery stenting. The process of coronary artery stenting enhances blood flow to the brain. People with significant carotid artery blockage benefit from it. Endovascular aneurysm repair. Ever the process of endovascular aneurysm repair? Ever. Fixes an aneurysm in the section of your aorta that passes through your abdomen. It entails inserting a stent graft into your aorta using a catheter in your upper thigh or groin. Comparable to EVER is thoracic endovascular aortic repair, TAVR. However, it addresses aneurysms in the aortic segment that passes through your chest. You can learn more about the stent operation you require from your healthcare provider. They'll discuss things like whether you'll be awake, how long you'll need to stay in the hospital, and what you may expect for recuperation. To reduce the chance of a blood clot forming in your stent, you might need to take medications for a while, possibly for the rest of your life. Pay close attention to your provider's instructions. Unless instructed to do so by your physician, do not discontinue taking your medication. What benefits do stents offer? Stents have the following benefits. They improve blood flow via the artery in which your doctor inserts them. They can prevent a heart attack in conjunction with angioplasty. They alleviate chest pain and other heart disease symptoms. They might prevent your arteries from being overly constricted once more. Compared to patients who undergo coronary artery bypass surgery, CABG, those who get a cardiac stent recover more quickly. The reason for this is that a stent can be obtained without a surgeon having to open your chest. What dangers come with placement? Stent implantation seldom results in serious problems. Serious problems are more likely to occur in people with diabetes, kidney illness, heart failure, or a history of arterial blockage. Among the potential dangers are a blood clot inside your stent, particularly if you stop taking your stent-protecting medication suddenly, an allergic reaction to the stent or its drug coating, bleeding where your doctor accessed your blood vessel, an infection, an artery tear, an irregular heartbeat, a stent leak or movement, or artery narrowing, once more stroke, heart attack, or cardiac arrest. Other titles include balloon angioplasty, coronary angioplasty, coronary artery angioplasty, percutaneous coronary intervention, percutaneous transluminal coronary angioplasty, and PCI, dilatation of the heart arteries, angina, implantation of a stent, stent placement for coronary artery disease, stent placement for acute coronary syndrome, CAD, placement of the stent, surgery for coronary heart disease, stent placement for an ACS, stent placement for a heart attack, implantation of a stent for myocardial infarction, stent placement for me, stent installation for coronary revascularization, prospective outlook. Angioplasty significantly increases blood flow through the heart and coronary arteries for the majority of patients. You might be able to avoid coronary artery bypass surgery, CABG, with its help. The cause of your artery blockage cannot be resolved by angioplasty. Your arteries might constrict once more. To lessen the risk of another blocked artery, maintain a heart-healthy diet. Exercise, quit smoking if you do, and manage stress. Your doctor might recommend medication to help control your blood pressure or lower your cholesterol. Taking these precautions will help lower your odds of complications from atherosclerosis. If you are enjoying this video, please subscribe my Boda Talk channel for more body insights. Thanks for watching. See you soon.